Today, we're talking with Dr. Carlos Martinez Arroyo, and he'll be sharing with us some reflections on how the healthcare community is dealing with the COVID-19 pandemic in Mexico. Welcome back to the AUA Inside Tract podcast. We have a very special guest on the line today, and I'm going to have him introduce himself right now and tell us a little bit about what he does.
Well, I'm Carlos Martinez from Mexico City. I work in Hospital Angeles Acoxpa in the private practice and in the University Hospital in Mexico, public hospital in Hospital Manuel G. Gonzalez. This is a COVID hospital. It's important for me and my other colleagues, urologists in the hospital.
Can you tell us about how the COVID-19 situation in Mexico is going right now and what's happening in Mexico City with COVID-19?
Okay, well, in this moment, yesterday exist 14,675 cases in Mexico, with the active confirmed COVID cases are in maybe 4,972, but the defunctions are 1,351 persons in all Mexico. In Mexico City, it's only 400, around 400. But in Mexico, making another epidemiology count is in the Sentinel model, and it calculate approximately 5,000 cases in Mexico.
How did your hospital prepare for this pandemic?
In the private hospital, they made a special wing from the patient's respiratory distress or respiratory symptoms, and make a trash to separate the COVID patient and not COVID patients, and make a special section to COVID. But in the University Hospital public, the COVID changed all the hospital. In my hospital has 6 floors. The 6th floor is UCI, and the operation rooms and the preoperative and postoperative care area changed to unit care, intensive and intermediate therapy from the COVID patients. In the past Thursday, the patients which have a need ventilator are 35 patients from 50 beds in this zone. The 5th floor is only COVID patients, no complicate with distress respiratory, and the 4th floor is only for all the one specialties, and the 3rd floor make a new unit care intensive for no patients COVID, and the 2nd floor is a floor for the ambulatory operations, and making only urgency surgeries and elective oncological surgeries. It's only make these surgeries because the hospital changed cancel all the surgeries and cancel the consultation because have a lot of patients. Maybe come 60, 65, 70 patients daily with symptoms respiratory. It's in this moment. This is the hospital, and they change in our department and our division of urology change all the surgeries, cancel, and the consultation. It's only prepared to COVID patients only, and all medical participate in a respiratory trash in emergency rooms. All specialties are are participate every day change with medical doctor and residents. Change every day the group of the attention.
How has COVID-19 impacted the urologists at your hospital? Are they being asked to assist with COVID patients?
The impact is all the consultations are canceled, the private and the public. Only emergency uh, situation are attended and not have surgeries. But when you have an COVID patients, you make all the ritual or maybe all the precautions to make the surgery. It's difficult. It's very difficult because you don't have the the situation to change or to make. And in Mexico, it's a special situation because do you know in the news, the PPA from the patient is, excuse me, and the medical doctors, and this is a really problem because don't have the good protection for attendant.
How do you think this pandemic will impact the way that healthcare is delivered throughout the world?
Well, I think this is very difficult to deliver this the attention because in Mexico is don't the patient make it to take a person to person and maybe to talk much more like US, and this is a very different because the patient go with one, two, or three families, uh, parents or spouse or daughters. I don't know. Could take only one person in the office or in the room, and this is a difficult. And delivery of the healthcare is maybe with another foundations or company who give the PPA the protection equipment.
What advice would you have for your colleagues around the world who are also dealing with this COVID-19 pandemic?
Well, I think it's the important are is the don't minimize the situation or the patient or the protection because maybe 40% of the medical who have the COVID are because have an mistake in to take the goggles or maybe the mask or the bag or the clothes, and it's very important because I think it's to have a more confidence and maybe more minimize the infection. And I think is the in this moment our colleges have a new form to make medicine. Video digital telemedicine is now maybe is the initial time to have the telemedicine in routinely, and maybe this is the new form to make the medicine when you not need to explore the patient or take directly the patient. I think it's maybe 60% of the consultations are with telemedicine, and maybe when you have all the studies, diagnostics with different media platforms in the world, you have a more form to take the consultation and the pay and our colleagues to have the new form to make the medicine. I think is the form to this moment because I think is the COVID not finally maybe in this year, and I think it's a periodic infection. And when you don't know the vaccine or maybe the exact treatment, you don't have you don't stop the life. They stop coming, the life coming, and is you have a new form to work from this moment.
Can you just comment on how this pandemic has changed or impacted everyday life for you or your family, and what that's been like?
Yes, well, in Mexico is with my family. My spouse are an anesthesiologist, and she making all the protection. Me, all the protection. My daughter is coming class in our home, and you stay at home and have a no near the family. But I think it's you learn to make this distancial this social distancing, because you are a new form the life, and you have a new form to work to have a new relations in the life. And maybe it's difficult, but the human have a lot of forms to accomplish the life.
Do you have any other final thoughts for us?
No, I only recommendation. Maybe I have a lot of friends in US, and I have this great problem in US, and Mexico is coming to this problem is serial, and I think it's only stay home, hand wash, use mask, and only life with all the recommendations and the protections.
Dr. Carlos Martinez Arroyo has been our guest today on the AUA Inside Tract podcast, and I want to thank him for his time today.
Thank you.